For your seated sciatic nerve glides, start by scooting to your edge of your chair. Now, the point of nerve gliding or nerve flossing is to decrease the irritation in your sciatic nerve. So we should not be having any numbness, burning, or tingling during or after this exercise. If you do, decrease the amount of motion that you move through. But all we're trying to do is try to get the nerve moving within its sheath. So if I straighten my knee all the way and bring my toes up, that is tautening your sciatic nerve all the way. So imagine if it's a rope, it's taking all the slack out. If I bend my knee and point my foot down, that puts some slack in it and has less tension. So we're going to be moving between those 2 points and then eventually adding in head movements because your nerves are connected to your spinal cord, which connects up to your brain. So it's a whole body movement. So the first thing that you need to do, make sure that you are not slumped down this way. Try to sit on the edge of your sit bones, or if you had a tail, try not to sit on your tail. So imagine that your tail is going off behind you. So sitting on my sit bones, my knee is a little bit straight, and I'm bringing my toes up, and then I'm going to point my toe to flatten it and bend my knee. So I'm kind of just sliding my foot back and forth. In this position, I'm tautening the sciatic nerve. You might feel a little bit of a stretch through your calf or anywhere along the back of your leg, maybe some in your back. And then when I come down, the stretch should be released. Now, when I tighten the nerve at the bottom, I want you to try to look up. And then when I come back to bend my knee, my head looks down. Straighten the knee, bring the toes up. Look up. Bend the knee, bring the head down. So we're just moving back and forth between these 2 positions. If you don't feel a big stretch right here, you could try to hinge your hip forward just slightly. Again, don't round your back to try to come more forward. Stay up on your sit bones, hinge forward. Do about 10 to 15 or however many your physical therapist asks you to do.